Welcome back to the Pops Podcast, where we uncover real, raw, and rarely discussed truths about pregnancy, birth, postpartum, and beyond. I'm your host, Dr. Emily Muery, prenatal and postpartum chiropractor, birth doula, and founder of Move Moms at Move Chiropractic Boulder. Today, we are diving into something that almost no one prepares you for, and that is what recovery looks like after birth interventions. So maybe you've had an epidural, Pitocin, antibiotics, or even a C-section, even just a little help to get labor going or throughout the delivery process. And now something in your body might feel off, maybe not broken, but just off. So this episode is going to help you build your understanding for those interventions and what to do for your body to help recover from said interventions. We're going to have some tangible takeaway items to help you detox and recover from whatever interventions you face during your labor and delivery. So let's dive into it. Postpartum is not, obviously, it's not a one-size-fits-all. We've talked about this before. Everybody looks different in pregnancy, labor, birth, and postpartum. So birth interventions can change how your body experiences the postpartum recovery process. Medication or altered labor positions or altered labor patterns, even surgical procedures, all create different needs for recovery, different tools that you'll need for this recovery process. So your body is not behind by any means. It's just navigating a very unique recovery process. Everybody's process is already unique. And then when you add on interventions, it's going to become even more unique and pinpoint niche how you can help your body. When we have additional interventions in our birth laboring process, typically we need additional processing after birth for the body to recover. Even with a smooth labor, interventions can add an extra layer of physiological processing. So the nervous system may be heightened or depleted. Muscles and fascia may be compensating around numbness or trauma. And then the liver, lymph, and the gut may be filtering out medications or managing new inflammation patterns as the body's trying to start its healing process. This episode is not about natural versus medicated births in any way. There's no shame for having an intervention or needing an intervention. It doesn't disqualify your strength or the labor and delivery that you had. So I want to be very clear as we continue to go down this. There's no shame in needing or wanting any of these interventions for your labor and birth. This episode is more about recognizing different ways that we can support the body after these interventions, not ways to critique our labor or birth. The goal here is recovery with intention. Your recovery is more than a checklist, and standard advice like rest, hydrate, walk often overlooks the intervention-specific needs that each mama might need depending on the labor and birth experience that she had. You deserve a plan that honors what your body has been through, and this episode is your invitation to get curious. Offer your body new ways, new tools to recover from or even detox, and not detox in a super unhealthy way, but we want to detox and recover and clear our body of what might have come in throughout our labor and birth that we don't need to stick around for this postpartum early motherhood experience. Let's dive into the actual interventions that affect our body or can impact our body's recovery experience postpartum. So in our nervous system, we have that either overdrive or shut down experience typically after a birth with medication. Interventions can influence how your nervous system processes labor and postpartum. For some people, there's overstimulation like shakiness, wired feeling, can't sleep, and for others, it's shut down, numb, foggy, disconnected feeling. Especially those with fast labors, Pitocin, cytotech, or trauma can keep women or moms postpartum in that overstimulated fight or flight state. Now, I want to circle back to the shaky, wired feeling, especially immediately postpartum. If you had an unmedicated birth and you experienced that shakiness immediately postpartum, it does not mean your nervous system is overstimulated. Your body is simply flushing out that natural adrenaline through your body because you have a fresh new baby. With interventions, sometimes those other interventions can't keep that adrenaline stuck in the body because the body is working on clearing out those other interventions. Now, moving into epidurals and mobility disruption, epidurals numb pain, right? We get the spinal tap, we get the epidural. It should numb the pain or the discomfort that we feel down below. you still feel pressure, but should numb that pain below. And before I keep going, we will go way deeper into each of these interventions in another episode. I really want to focus on the recovery from each of these interventions because I've been seeing a lot more of that in my office. I'll get back to explaining each intervention, pros, cons, benefits, risks, alternatives in another episode. But back to epidurals. Epidurals numb pain. When we numb the pain, they can also change, or the epidural can also change your muscle tone and your pelvic awareness and your mobility. Since there isn't as much awareness typically with an epidural, even though you can sometimes have movement, sometimes you can't. It totally depends on the cocktail that your anesthesiologist makes up for your epidural. If you happen to not be able to move and you need assistance during pushing or the pushing part of labor, typically you'll have a nurse on one side and your birth partner or another nurse on the other side that will be moving your legs. Nobody knows your active range of motion except for you when you're using it. However, in this moment, you can't feel it, but you're awake and you're going to be actively being put into these pushing positions. So it doesn't happen often, but it can happen, especially with a birthing partner who may be not so aware of how much pressure to put into these movements. When you push a woman's leg back so she can get into that pushing position, and I want you to picture this, a woman laying on a hospital bed with her legs in the stirrups and then picking the legs up out of the stirrups and helping her push. That pushing or that movement of the legs back into the hip joints, depending on how much pressure is getting put back there, sometimes it can be too much for mom. It can push mom past her physiological range. It can put her into some distress in those hip joints. And this isn't the only area of the body that this can happen to, but this is the most common that I see. Even though it doesn't happen commonly, when it does happen, I most commonly see it in the hips. Now, these shifts from the epidural with the muscle tone, the pelvic awareness, mobility, these shifts can create tension patterns, pelvic floor imbalances, or even delayed reconnection to the area. Many people don't realize that their body's still moving around protectively, even weeks, months after labor and birth, because they feel like that's their new normal, their new postpartum body, new sorenesses, new discomforts, new structure. I'm here to tell you that's not the case. Pitocin is the synthetic form of oxytocin and helps create contractions, but it doesn't bring the same natural feel-good bonding as natural oxytocin. Pitocin also takes a little bit to clear out of the body, not nearly as long as any of the other interventions that we'll talk about. However, there's a lot of immediate things that happen postpartum that require oxytocin. So when we have Pitocin pumping through our bodies, it can be a little bit more difficult for your body to pick up those oxytocin signals to start pumping it out, to create that bonding, to create the milk production, to create all those things that we've talked about in the past. The uterus can feel sore and crampy, and it can take longer to calm down with Pitocin. Because Pitocin is the synthetic form of oxytocin, it's going to create those arrhythmical contractions just to get those contractions going. Sometimes those arrhythmical contractions are, one, arrhythmical, they're not within your body's rhythm. Two, they can be a lot more intense than a typical natural contraction that your body would have created on its own. So it's normal for that uterus to feel a little bit more sore and take longer to recover after Pitocin, just because it's been experiencing more intense, probably bigger, longer, and arrhythmical contractions throughout labor and birth. So why do we use magnesium with preeclampsia? Eclampsia itself, without the eclampsia can cause seizures. Obviously, not safe for mom while she's trying to deliver a baby. Preeclampsia is telling us that we're getting close to that threshold of mom experiencing some of those really gnarly side effects, such as seizures. So, magnesium is used to prevent the seizures with preeclamptic moms. However, magnesium can leave you feeling extremely drained, weak, and foggy. For most of my moms during labor, they experience a lack of visual clarity. It looks very blurry and their eyes feel really heavy, similar to having your eyes dilated at the eye doctor. Now, magnesium sulfate takes a longer time to clear out of the body. It's not like magnesium citrate or magnesium glycinate. Magnesium citrate you would be taking to help with constipation. Magnesium glycinate you would be taking to help with sleeping or restless leg, something like that. So magnesium sulfate, this is a different form of magnesium. It's going to take longer to clear out of your body. Your body may need some extra time and support to regain full energy and mental clarity. This is why I tell my magnesium moms or moms who go through magnesium during their labor and delivery to really lean on support immediately postpartum and give yourself time. Moving on to cervical ripeners and intense labor onset. Medications like Cytotec or Cervidil can trigger strong, sudden contractions, especially if the body wasn't ready. They're cervical ripeners, so they should be ripening the cervix. They should be helping the cervix dilate and efface. They really shouldn't be starting contractions. However, a lot of times your body needs the cervix to dilate or efface to start contractions. Not everybody, but some people. So when your body starts getting medications like this to start softening the cervix, it sometimes is natural for those contractions to start out of nowhere because all of a sudden the cervix is ripe and it's ready to go. This can overwhelm the nervous system. It can contribute to fatigue or emotional shock, even birth trauma. It's common with cervical ripeners. It's common to feel like labor came on like a freight train. It just came out of nowhere. And then your recovery may reflect that intensity. Whether it's multiple days of intense recovery where you're like, I cannot move, or maybe not. Most often we see pretty intense recovery after some pretty big experiences with cervical softeners. Now, moving on to C-sections, forceps, and vacuum births. These interventions can involve surgical trauma or intense force, which can impact the fascia, core function, and scar tissue of mom. The body may form protective holding patterns from said experiences, especially around the incision or the pelvic floor in general. Posture, digestion, and movement may all be subtly affected, especially because you're going to be recovering from these surgical traumas or these intense forces for a bit longer, which typically means you're in your bed longer, you're in a reclined position or a sitting position much longer than a typical postpartum mom. That's okay. Again, bringing awareness to different recovery needs for different people. Episiotomies and tearing. Even small perineal tears or stitches can affect the pelvic floor function and nervous system sensitivity. Before I keep going, it's normal to have small tears. Even unmedicated moms have small tears. Medicated moms have small tears. Unmedicated moms have big tears. Medicated moms have big tears. We cannot tell most of the time. You just don't know if you're going to tear. A lot of times I'll have mamas come into the office and one of their biggest goals is no tearing. And I want so badly to support that, and I do support that. I know the reality is that you really don't know if there's going to be tearing or not, and it really does depend on the labor, the birth, baby's expulsion out of the birth canal, how long they're crowning, if they're not crowning. It all depends. So before we move on, it is normal to have some tearing. Everybody heals. I wouldn't say it's like getting a scrape on your knee, but in the same way that everybody falls off their bike and scrapes their knee sometime. Most people experience a little bit of tearing. And I'm going to say this, maybe not most people. I would say some people experience tearing and some people experience no tearing. There's no direct reflection or indication of what tearing comes from. We've had 10-pound babies with no tearing, and I've had 5-pound babies with lots of tearing. So, nonetheless, let's keep moving. Scar tissue from these experiences can create tension patterns or discomfort, especially with sitting or using the restroom, often early on, and then you become more tolerable later. This is why, even if you become tolerable to certain things that have happened or changed in your body because of labor and birth, it's important to have recovery or a recovery plan to help those things dissipate out of your body so that you can ideally have another pregnancy if you'd like to, or have your body back. However, whatever it is that you want to move forward with your body, taking care of even just the smallest tears or having a recovery plan can benefit you greatly. Imagine how much you sit. It's a lot, right? Sitting and having discomfort from scar tissue pulling every single time is eventually going to lead into a serious tension pattern throughout your whole body. So, the sooner that you can recognize this is creating some tension, or if you can't recognize it and you already have a plan, I don't have the awareness of what's going on down there, but I know that I need to recover. Please help me. That's what we're helping moms with in our office. A lot of times they don't have awareness of what's changed in their body. They're so focused on baby that they don't have a ton of physical awareness right now. They're checking in with baby nonstop and not having a ton of time to check in with their own bodies to see what recovery is needed. So having this recovery plan prior to being in recovery can really help set aside a planned time to help mom, even though a lot of your attention is already going to be on baby. My attention and your birth team or your postpartum team's attention is going to be on you and helping you recover. I also focus on baby too, but when it's baby's time for an adjustment. Moving on, because I keep stopping and having little rants for episiotomies and tearing, reconnection to your pelvic area may take gentle and very intentional work. Sometimes that's body work, sometimes that's psychological work. It all matters. Everybody's different, and everybody's recovery or what's going to be most beneficial is going to be different for everybody. IV fluids, antibiotics, and gut health. We've talked a lot about this in a microbiome episode, so I won't dive too deep into this one, but high volumes, and this one I think a lot of people forget about, is high volumes of IV fluid. You think an IV is great, it's hydrating your body, but however, you're in a new state. You're in a laboring and delivery and then postpartum state. So, having high volumes of IV fluid can cause swelling, water retention, and a sluggish lymphatic flow. Antibiotics, especially for GBS or a C section, can disrupt the gut microbiome. We've already talked about it, impacting your mood, immunity, and digestion. Please go listen to the microbiome episode if you haven't already. I cover this entire topic. Your liver and your gut may also be quietly doing extra work postpartum to filter out medications and rebalance hormones and fluid levels. Now, going into general anesthesia and full body recovery. General anesthesia doesn't happen as commonly as we think. A lot of C-sections. So let's break it down. In the United States, 1 in 3 babies is C-section. Right now, 33% of births is C-section. Now, of those C-section mamas, I would say about 70 to 80% of them just have their spinal epidural. They don't go under general anesthesia. It's used for emergency C-sections, especially if we don't have time to do the spinal epidural and let it get to work. And if you've ever been under general anesthesia, you might know that it can leave lasting effects of nausea, confusion, and deep fatigue. It impacts not just your alertness, but how the nervous system integrates the birth experience as a whole. Recovery may feel slower or more disoriented. This does not mean you're a failure or that there's something wrong with you. That's just the real response to anesthesia. It's the real response to going through a serious surgery. If you've ever had a surgery, I think a lot of people would tell you it takes a while for your body to come back online. I one time I had surgery in my armpit and I had to cancel my summer classes at college because I could not communicate with my body. I could not make everything work just because my body was still coming off of that anesthesia. So, general anesthesia can take some more time for your body to come back online and actually start the recovery process in general. Recovery as a whole is not just physical, it's cellular. These effects aren't always just felt as pain points in the body. Sometimes it's fatigue, sometimes it's brain fog, sometimes it's just not feeling like yourself, feeling really sad, really depressed. This is where some of our baby blues come in because the body's just not online. Our nervous system can't speak to our brain, to our body quick enough, long enough for us to have any communication or enough communication to overcome these obstacles within our body. Your body is processing and integrating the birth on multiple levels. We've talked about this in a couple different episodes, how your body in our postpartum episodes, how your body processes hormones, how your body processes bonding, how your body processes holding and being around people. All these different things are different layers of recovery that your body is going through to find its new normal and to find its new way of functioning. Knowing this helps you to respond with compassion and support instead of frustration, especially with yourself. If you're looking at yourself in the mirror and you're like, oh, why don't I look normal? Why don't I feel normal? If you're talking with someone or you just finished a conversation, you're like, ugh, I'm just not myself. It's okay. Give yourself some compassion and some grace. Your body is still processing medications, hormones, stuff that's not used to processing on a day in and day out, as a daily routine thing inside of your body. So it's okay to take more time for your body to process and flush out some of these medications, some of these interventions, some of these physical touches that you experience during labor and birth. It doesn't just have to be interventions, it can be something that someone said to you or something that you saw or whatever it is. Sometimes different things in birth spaces, not just interventions, take a while for our body to recover from and actually find a new normal or a new understanding of what we now know. So let's move into how we support each of these systems depending on what's been affected, what has changed, what's feeling funky inside of our body. I'm, of course, going to start with the nervous system because the nervous system, like the engine of a car, runs everything. If your nervous system is shut down or overstimulated, which is just as, I wouldn't say bad. Bad's not a right word. It's similar to being shut down. Overstimulated is no better than being shut down. We want to find that balance in our nervous system so that our body can heal, can process, can parent the baby in front of us, and so that we can actually start moving through this new stage of life, parenthood. Supporting the nervous system, why the nervous system needs support after birth. Birth itself is a nervous system event. Again, the engine drives everything in the car. It makes the car drive. Your nervous system makes the birth happen. That's why when I talk about overstressed out nervous systems, it's really hard to have an unmedicated birth or no interventions because your nervous system can't drive labor. There's a missing steering wheel or the foot pedal's stuck. Whatever it is, we're trying to open up that nervous system, open up the engine, make sure that the engine works so that the car can drive wherever we need it to go, so that your body can labor wherever it needs to go. So when the nervous system isn't quite online, a lot of times we need help for the nervous system to help drive that car or drive the body into labor and birth. So birth itself is a nervous system event. Your brain and your nervous system are driving the entire labor and birth experience. If you add in interventions, you're going to add a load onto the nervous system that is already like overfunctioning for. I wouldn't say overfunctioning. Your nervous system is built to deliver a baby. Then we put it into labor and birth. It gets somewhat stimulated because a lot of things are happening. It's trying to get you through labor and birth, and then we add interventions on top of it. Now it's processing medication, intervention, this change, physical change, mobility change, whatever it is, on top of all the other things it's trying to help you do for labor and birth. Whether you felt hyper alert or numb or overwhelmed, maybe out of your body, that's your nervous system trying to protect you during, through, and after labor and birth. Recovery isn't just physical, it's about regulation, integration, and restoring safety in the body. So again, I'm just going to read that again because it's so important. Recovery isn't just physical. It's also about regulation, integration, and restoring safety in the body. You can do all the PT exercises and you can go to talk therapy or bodywork therapy. But if your nervous system is not back online and helping your brain communicate to your body and vice versa, body to brain, it's going to be really difficult for that regulation and integration of the birth to happen within your body. That's why it's so important to have a recovery plan for your nervous system, medicated or unmedicated. Have a plan for your nervous system. It needs help finding its new regular so that it can be regulated or a regulator for your baby. So, how do we help this nervous system come back online? We have simple grounding practices like gentle breath work. You can do box breathing or slow exhales. Helps calm your vagus nerve. Your vagus nerve is the parasympathetic dominator in your entire body. If that vagus nerve is stimulated, that rest and digest state is way more available and achievable in your body. How do we get there? You can try, obviously, the gentle breath work that I told you, gargling, humming, or lying on the floor. So, gargling water, obviously, I just have that as my first one. Gargling water, humming, or cold water. Did I say laying on the floor? That's for my next one. Cold water splashes on your face to stimulate vagal tone and a shift into the rest or digest. All of those things also help that vagus nerve kind of get a spark of awakeness. Hello, we're waking up. We're trying to turn on that vagal tone, gargling water, humming, or cold splashes on the face. Or you can walk barefoot. Try walking barefoot outside. Walking barefoot inside is one thing. But let's get outside, let's touch grass, let's put our feet in the dirt. If it's snowy around the time that you're having a baby, put your feet in the snow. Wake up. I'm not telling you to wake up. Wake up your senses, though. Put your feet in the snow and see what you can do. It might be a little overstimulating, but it will be very grounding. You'll be like, holy moly, this is real snow on my real foot. Your nervous system is going to take that and find your way back to a nice regulated nervous system. It's probably not all you need. Touching grass or snow is probably not the only thing that will bring your body back to regulated nervous system, but it can definitely help. And then we also have less stimulus, more stillness. Your nervous system may be craving quiet, calm, and predictability, even if your mind wants stimulation, especially postpartum. It might be quiet in your house and a lot might not be happening. Baby's sleeping all the time. Your body is still trying to come off of these overstimulated fight or flight experiences, medications, interventions, whatever it is that happened during your labor and birth. Your body might be asking for that quiet, calm, predictability schedule in your house. So when you fill your baby's nap times with your phone or a TV show, sometimes it's going to be really hard for your body to keep that recovery process going. If you can really utilize that fourth trimester to recover as well as meet your baby and get into the new rigmarole of having a baby and what your guys' routine is and what positions baby likes. This can really help your body get into that new routine, that new schedule, that new feeling of your body being in parenthood and being in motherhood. Taking the screens away can really help your body stay just as regulated as much as you were trying to help regulate your babies. A lot of times I hear mamas like, no screen time for baby until they're 2. But mamas staying up and watching Love Island every night of the summer. Mamas need to be just as regulated as their babies because who is baby regulating off of? Mom. So, mom, if you're overstimulating your brain or your mind with screens, TV shows, different media, that can translate into overstimulation of your baby just because your system itself isn't actually being regulated. Say no to extra noise, notifications, and screen time when you can. It's not selfish, it's your nervous system medicine. It's okay to say no. It's okay to not answer to every text. Maybe set one of baby's nap times, whether it's their morning nap, their afternoon nap. I know babies take lots of naps. Find a nap in the day where that can be your nap to respond to people. Ideally, we're not doing this during a contact nap. We really want that bonding to happen during contact naps. So if baby happens to be napping somewhere else, this is the time for you to, for one nap, answer all your people, get your screen time out of the way so that you can be back and focused with baby. Because one thing is, if you're not picking up your phone, but you know that there's just text messages piling up, there's emails piling up, and you want to be able to get back to them, it might start adding some stress on you. So if you can slowly chip away at some of those messages, get back to people, but do it in an ideal time, it can be really beneficial, not only for your healing, but also for your connection with community, and then also time with baby being very present and still and, authentic, real, raw, truthful. Pull out your essential oils, lower the lights, and give your senses a break, especially in the evenings. If you can just wind down, everything included. Think about all your senses. We have sight, ideally no screens. We have scent, maybe nothing crazy in the atmosphere, but some essential oils. Noise, making sure that we're not blasting our ears with crazy noise or stimulation or whatever it is that might be creating noise in your ears. Touch, soft blanket, feeling comfortable. And taste, having healthy, nutritious, nourishing foods in our bodies can really help your body to recover naturally, right? That one seems so obvious. That's why I said it like that. Body-based regulation tools. So very, very obvious. Chiropractic adjustments. We can help shift your nervous system out of fight or flight and back into that rest or digest, or at least that really even balance so that you can experience both on an even playing field. That really is the goal. We want to be balanced in both sympathetic and parasympathetic. Chiropractic is the #1 recommendation to get you there. Craniosacral therapy, myofascial release, or lymphatic drainage offer gentle hands-on ways to release stored tension. Now, the lymphatic drainage, I highly, highly recommend to any of my moms who experience any medication or IV fluids during labor and birth. It really helps make sure that the lymph is flushing out anything that it's holding on to, anything that it really got married to or thought was super cozy, whether it's medication or that water retention. We want to make sure that nothing like that is getting stuck in our body. We want to flush it out. Even just being touched with intentional care by a doula, a partner, or a provider can regulate your system. A lot of times I watch women, they come in, just like I said in that episode last week, they come in, they've had a crazy car ride, baby's stimulated, they're stimulated, we get baby taken care of, they're happy, and they're just hanging out. Mom comes to lay down on the table, and I just put my hands, she'll lay face down, I'll put my hands on her calves to remind her, like, I'm here, we're starting the adjustment, and that touch alone, I see women take a deep breath that seems like they haven't been able to take in who knows how long. That right there is just the start of regulation. If you can find small points like this, if you don't have a postpartum chiropractor, if you don't have a body worker to help you recover, hopefully you can find some spots in your house, find some comfortable positions and some comfortable touching patterns that your partner can do to help you relax and recover. Again, having this as part of the plan really helps prepare partner to be more supportive for you in postpartum. I think a lot of times it gets confusing where our birth partners or our spouse's support could be most beneficial in postpartum. It's like, can I change baby's diaper? Can I get baby's bottle ready? Yes, those things are great and they're super helpful. It also is really helpful. What can we do for mom to get her nervous system back online and back to where she can be in her body and create thoughts and create ideas and create memories and just be in the moment with her baby. Now, rest is our nervous system rehab. Sleep isn't just about energy, it's about when the nervous system repairs and actually integrates the experiences that we experience when we're not asleep. Even if you can't get long stretches of sleep or rest, prioritize naps, quiet time, and off-duty moments whenever possible. This will allow your body to rest. I use this same topic when I talk to normal patients in our office, normal non-pregnant patients in our office. We'll talk about loss of disc space in their spine. So you have bony segments in your spine, and in between each of those bony segments is this really spongy, watery disc. Now that water, that hydration, we dehydrate as we use our spine and our bodies throughout the day. When you lay at night horizontal and sleep and rejuvenate, your body actually rehydrates those discs so that they can be rejuvenated for the next day so that you can use it. In early parenthood, even during pregnancy, sometimes moms don't get a ton of sleep. If you're not getting a ton of sleep or rest in that horizontal position, those segments, those spongy discs in between our segments, don't get a ton of rejuvenation or rehydration. And so mom gets more and more and more compressed every single day postpartum. That's why rest is so important. I at the same time don't want to say like you're going to be up multiple times throughout the night. That is typically what happens with a newborn baby. They get up, they want to feed, you feed them. This is just to say, the more that you can give your body rest or restful times throughout the day, even when you're not with your baby or even when you are with your baby, can really help your body to rejuvenate these discs in between space, even if it's in smaller chunks rather than one long stretch at night. Okay, you guys, I'm super excited about this new sponsor because it's somebody I've actually been working with for a while now called The Final Punctuation. It's a female-owned, one-woman editing and proofreading service. Her name is Carrie, and she has completely changed how confident I feel putting my words into the world. She's helped me with everything from my brochures to my doula contracts to small marketing things. And not only is her turnaround time incredible, but she helps you to understand the why behind her edits. She sees things that I would have never caught and somehow keeps your voice intact while making everything stronger, cleaner, and clearer. She works with all kinds of creators, from bloggers, podcasters, to small business owners, marketing folks, and even students. Anyone putting their words out into the world. And if you've ever posted something and noticed a typo after, you know how it feels. One tiny error can totally kill that first impression. In fact, stats show that only one typo can increase bounce rates by up to 85%, and grammar mistakes turn away nearly 60% of readers. And I know what you're thinking about AI. Can it just take care of all my grammar mechanics? AI still struggles with tone, nuance, and accuracy, which is not a great combo if you're trying to earn trust. So if you're writing anything from podcasts to brochures, website copy, marketing materials, let Carrie take a look at it. Visit thefinalpunctuation.com to submit a request for any project and tell her that you're a Pop Podcast listener for 15% off your first order. That's thefinalpunctuation.com. Now let's get back to the episode. Restoring fascia in muscles. Interventions that disrupt natural movement patterns like epidurals, surgical positioning, assisted deliveries like the forceps or vacuum that I talked about, or even long labors often can cause some compensations in posture and movement. I typically see this when we don't shift mom's position frequently enough throughout labor and birth. I've said this in many episodes. Make sure that you're shifting positions during labor and birth about every 30 minutes, if not more. That 30-minute movement can really help make sure that funky compensation patterns don't start from labor. However, sometimes they still do, depending on how your labor is going and what's beneficial for baby, what's working, what's helping baby descend. Sometimes you end up in a position longer than 30 minutes, and sometimes that creates tension, discomfort, tension patterns within your body that lead to pain later down the line. So these compensations in your posture and movement, we need to start releasing. Your muscles may have stepped back in to protect you, whether they thought your hips were going to dislocate or whether they thought your back was going to give out or your body was getting tired, your legs were getting tired, your knees were getting tired, whatever it was, your body or those muscles will start to step in to protect, quote unquote, protect your structure and your body. However, if you've ever noticed, tight muscles don't necessarily feel like they're protecting your body. It feels like soreness. It feels like tight muscles. So you might feel tight, you might feel twisted, you might feel disconnected. That does not mean you're weak or that you failed or that there's something wrong with you or that you're broken. It's just your body asking for recalibration and openness. Openness coming through typically nervous system communication or massage release. Again, back to the chiropractic adjustments or massage therapy. This can really help bring everybody back online. Fascia. Fascia holds on to birth literally. Fascia is the connective tissue or the webbing in and around throughout your entire body around muscles, bones, ligaments, all the fun stuff. It's sensitive, it's responsive, and it holds tension. It holds and accumulates stress patterns just like anything else in your body or anything else in the world. Interventions like C-sections, IV placements, forceful pushing can create fascial restrictions that impact how you move, digest, and breathe. All of these I see often in the office, more often C-section recoveries and then forceful pushing. The IV placements, I've never seen fascia tense from that. Not to say that it's not possible. However, typically we're focusing more on the forceful or force-used births, whether it's C-section, forceps, or vacuum. And typically, we're looking at how those fascial restrictions can be released so that there can be openness for a future pregnancy. Not to say that we wouldn't do this for moms who aren't planning on having another baby. We want their bodies to feel normal and back to full functionality. However, this is where I really work with my C-section moms and my forceful pushing moms, especially if I was in the room during the labor. I'm like, okay, let's get back to chiropractic as soon as possible. It's not going to look like your normal chiropractic adjustment. We are going to be doing different types of adjustments to make sure that the scar tissue still has communication from your nervous system. It's not numb or has a lack of life force for the rest of your life. We want to make sure that your body is able to integrate some of these big fascial changes or holds or tension patterns, whether it's from a surgical scar or just intense pushing. All of it needs to be addressed, taken care of, and recovered. Gentle touch, myofascial release, and stretching can help free up stuck areas and restore body flow, whether that's blood, energy, all the fun things. Scar tissue that needs attention. So if you've had a C-section, episiotomy, or a tear, scar tissue doesn't just heal on its own. It typically needs very intentional care outside of the medical stitching or, recovery that you're getting in the moment immediately postpartum. Scar tissue can restrict fascia, creating pulling or numbness and alter pelvic floor or core mechanics. Once your provider gives you the green light, try a scar tissue massage, body work, or work with a pelvic floor therapist trained in postpartum care. Now, chiropractors, it is not within my scope to put my hand or any part of my body inside your body. So that is not for me, especially if there is some cervical scar tissue tearing, stuff like that. I usually recommend my patients to go to a pelvic floor physical therapist, not because they're going to massage out the scar tissue, but a lot of times they can use their scope has internal practices. So they can use their internal work to actually help you activate different muscles or different areas of your body to start bringing consciousness or awareness down to that area for healing to actually start. So the reconnection and rehabilitation, this is not telling you need to bounce back by any means. You just need to reconnect with your body with curiosity and care. Start with small mindful events like pelvic tilts, cat-cow, supported squats, breathing into your belly and into your ribs. We do a lot of decompression breathing during pregnancy so that it's readily available for postpartum recovery. These little movements tell your brain, this is my body again. This is my first step towards strength. This is how we move. This is how we breathe. This is how we integrate. This is how we do all of these things with a baby now on the outside of us. Like I said before, body work and gentle movements are so powerful. Chiropractic care helps restore the alignment, mobility, especially if labor positions or interventions hold you out of balance. Yoga, Pilates, and postpartum rehab classes, when you're ready, can help you rebuild the function from the inside out. It's not about the intensity, it's about reawakening awareness in your core, hips, and spine. Now, let me remind you what I just read there. Chiropractic adjustments help that nervous system get online. If you are not receiving chiropractic adjustments and you go straight to the yoga, Pilates, or postpartum rehab classes, a lot of times there's not a ton of change or a ton of success in changing how your body's coming online because you didn't do anything about your nervous system. And that nervous system is cared for through chiropractic care. That's the specialty of chiropractic care. So go get yourself a chiropractor, prenatally and postpartum. It's really going to help any other care or any other things that you do actually have an impact on your body when you do those things. Moving into supporting the gut and liver, why the gut and liver matter so much post-intervention. Your gut and liver are two of your body's major detox and regulation stations. After birth interventions, especially antibiotics, IV fluids, anesthesia, they overwork to restore balance, your liver and your gut. They will overwork to restore that balance. Supporting these systems can help with your energy, your mood, your digestion, your immunity, and even inflammation. Antibiotics and the microbiome, again, I've talked about this, so Just brief reminder here, antibiotics will wipe out both harmful and beneficial bacteria, which can lead to bloating, irregular digestion, yeast overgrowth, or lowered immunity. So support with probiotic rich foods like sauerkraut, kimchi, or consider a high quality probiotic supplement. There are some great probiotic supplements. Go watch the microbiome episode because they're in that episode. Gut health affects your mental health. Gut bacteria produces neurotransmitters like serotonin and GABA, which influence mood and anxiety. A disrupted microbiome can make you feel on edge, foggy, or emotionally flat. It's not just your hormones. It's not just that hormonal drop. Nourishing your gut is a form of emotional and mental support too. Your liver filters out medication, hormones, and waste. It's doing double duty postpartum. Medications, hormones, and waste. You don't need a harsh cleanse. Like I just said, you do not need a harsh cleanse your liver. You need gentle, consistent support. So focus on lemon water or warm herbal teas. Usually like dandelion or nettle are really good for clearing out your body. Arugula, bok choy, broccoli, horseradish, mustard, radishes, wasabi, broccoli. I think I said broccoli. Vegetables like that really help clear out that liver. And then also regular movement and sweating helps stimulate lymph and circulation. So a good sauna session, a good sweat sitting out in the sun, really just letting your body sweat it out, start stimulating that circulation, make sure that everything's getting out. Now, don't forget to poop. I put that in big words on here. Don't forget to poop. Medications and inactivity often make bowel movements sluggish, which can delay recovery and increase discomfort. A lot of times at hospitals, they'll give you medications after you've had medications. So they'll give you medications after interventions to help with this exact issue. They'll give you a medication so that your poop is soft. It's literally just called stool softeners. They'll give you some form of a stool softener, typically at a hospital, so that your poop can come out soft. Medications and interventions does not equal recovery. Sometimes it does, but this is an opportunity for you. If you didn't want to have any medical interventions and you didn't want to experience medication, this is your opportunity to now get back onto that natural side if you really want to, and not clear your body out with more medications. More medications lead to more side effects, more things that your body has to recover from. So if you can do this a little bit more holistically, a little bit more naturally, raw, authentic, you're going to have less things to deal with after that other medication. So stay ahead of your constipation with magnesium citrate or calm powder. Be thoughtful of which powder you're using, how much it's been processed, what's in it. Look at the ingredients. Hydration and fiber-rich foods. Flaxseed is also really, really great stool softener and really helpful for your body in many different ways. And then gentle movement like walking or rocking. Walking allows blood flow to the pelvis. If you've had a significantly big birth, all births are big. I was thinking more like C-section, forceps, vacuum. You might need to wait for walking for just a little bit longer than an unmedicated mom. However, walking itself will stimulate more blood flow to the pelvis, which stimulates more nutrition, more oxygen, more everything to help your body poop and actually get stuff going. Consistency over complexity. You do not need to overhaul your diet or take 10 supplements postpartum just to get back to normal. Start small with supportive habits, whether that's 1 cup of tea, 1 serving of fermented food, 1 walk a day, whatever that is, sitting in front of the window and just breathing for 15 minutes while the air breezes on your skin, whatever it is. Find small things, small shifts that you can make in your body where you're telling your body, I love you. I care for you. It's safe. We can do these things. It's nothing big. We just do our normal 4 o'clock tea time or a normal 2 o'clock cacao time. I know my friend Sarah always does cacao every day. She's over a year postpartum, and this is her new ritual every day to find a little bit more consistency in finding time for herself. So this consistency for finding time for yourself can be not just help you recover from labor and birth, but it really can help you regulate throughout postpartum and throughout motherhood when you have overstimulated days, or you have overexciting days with your baby, whatever it is that has come up. Now, I want to get back to a couple different lymphatic recovery support ideas that you can use if you don't want to or don't have a lymphatic drainage massage waiting for you postpartum. If you're like, what else can I do at home to drain my lymph on my own? Here are some ideas. The lymphatic system clears waste from the body, but after IV fluids, antibiotics, and swelling, it can be kind of sluggish, like we talked about before. So tools like dry brushing, you can dry brush your entire body. Just a couple years ago, I got a dry brush for my face from some beauty package, and it was great. I was watching a lot of swelling go down in my face. I was just noticing that my body was draining out gross toxins, whatever it was from the night before, with that dry brush in the morning. You can dry brush your entire body. This is these are actual practices that other cultures use normally. It's just different or new for our culture here in the United States. But dry brushing your entire body can really help with lymphatic drainage, postpartum or not. I think it's great for any individual, and I tell non-pregnant individuals to do this as well. Gentle massage, like we talked about before. Rebounding, which is like small jumps or getting on a mini trampoline. It doesn't have to be. I realize how crazy that might sound for some women postpartum. Like, are you crazy? I'm not going to get on a trampoline. Like, I'm going to pee myself. This is not to like get you to pee yourself, but a lot of times this can promote lymphatic drainage. So if you have a birth ball at home from your prenatal movements or exercises that you're doing, you can sit with baby on the ball, and those little bounces can help that upper body really start draining some of that lymphatic stuckness or sluggishness in your body. Before I dive into this next section, this is not to over stress out any mamas. This is just some simple things to look for. I will do a separate episode on a more serious episode on the effects of different interventions on babies. This is more, again, about the recovery process, regardless of what happens. We all need to recover, but a lot of times we don't plan to need to recover from certain things until after the things happen. We're like, oh my gosh, XYZ happened and now I have to recover from XYZ. Baby's birth experience matters too, and there's different things baby may have to recover from as well. Interventions don't just affect you, they also shape how your baby transitions into the world. Fast labors, assisted labors, Pitocin, antibiotics, and C-sections can all impact how baby feeds, sleeps, and regulates. This is not about blame. Like I said before, I'm not blaming anybody. There's no blame game here. Nobody's wrong or incorrect for doing anything specific, but we do need to recognize the support that your baby may need as well as you. So your nervous system, or the nervous system in newborns, babies process birth through their bodies, through their nervous systems, just like we do. And so any signs of nervous system strain may look like this: startling really easily or difficulty calming, tense or rigid body, especially in the neck or jaw, asymmetrical movement favoring one side. This is the most obvious, especially if you're using a car seat and you notice that your baby's always looking to one specific side. This one's usually the most obvious to identify. Struggling to latch or stay latched. This one's also pretty easy to identify. And a lot of times before you go home, it's noted at the birth space, whether baby's latching, needing some help latching, whatever it is. And then frequent hiccups, reflux, or gassiness. All of these things I help newborns with in our office. I see them all the time, even with our unmedicated moms. Baby just had a fast birth. They just came out really quick, or they did a couple flips, or they had the cord wrapped around their neck a couple times and their body just needed some time to wake up. Whatever it is, we work through all of these in the office. I work with babies typically a lot longer than I work with adults, just because their systems, they can't tell me what's wrong. We just see it. And so we're doing adjustments and watching their reaction, and we're doing adjustments and we're watching how their body reflects that new adjustment, if there's any change. A lot of times we'll watch babies, we'll do an adjustment and their head will be like boop, 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 right back to center. It's awesome. It's so cool. We can also help baby with digestion. There's so many things that body work and chiropractic can do for your baby, just regulating their nervous system and getting them back online. All of the things I just explained, though, none of those are emergent. If you experience or see this happening with your baby, this is not so emergent that you need to make a decision right this second on how to help your baby. A lot of times, you can text your chiropractor. A lot of moms will text me over the weekend, XYZ happened. And I'm like, great. I'm going to see you at your appointment this week, or if you want to move it up a little bit earlier, we can totally do that. We'll take care of it then, and then we'll decide what, we'll see if there's any other things that we need to do after this. A lot of times we can release tongue ties, cheek ties, buccal ties, all in the office before baby ever needs a tongue release, cheek release, full release, whatever it is, hiccuping, or medications. A lot of these small things that seem rather big because it's happening in a small human's body and it's happening right in front of your eyes, and you're like, I don't know if this is normal, I don't know if this is abnormal, who do we call? A lot of times it gets transferred immediately back to the hospital. What's the hospital for? Emergencies. Guess what? None of these are emergencies. So a lot of times they're going to treat your baby with these small symptoms as emergent. Babies don't need to be treated as emergent because then we do things that we can't undo. So this is my gentle recommendation. If you experience any of these with your baby, or anybody tells you that they see these things with your baby, send a text message to a prenatal chiropractor, call prenatal chiropractor, or prenatal, call an infant or pediatric chiropractor so that they can help make sure that your baby is getting that adjustment back into the world, whether it's feeding. I've had a couple mamas come in who have seen lactation consultants many times, and all it took was just reposturing or finding a new posture for baby or mom to sit in for feeding, and just like that, baby latches, they're good to go. I could go through each of these and explain how we could take care of them, but I've already done enough. So let's keep going. All of those things that I just said, those are clues. They're not diagnoses. That's why they are not emergent. They are just clues that baby may benefit from some nervous system support. Gentle body work for baby, like pediatric chiropractic care, can address tension, alignment, and latch mechanisms in a gentle, baby-led way. That is the best way I've ever been able to put my words. It is baby-led. Our non-pregnant, non-baby adjustments, they're mostly chiropractic-led, I'll be honest. You come to the chiropractor, I'm looking for subluxations in your spine. If you go to the dentist, they're looking for cavities in your teeth. If you come to me, I'm looking for subluxations in your spine. However, with babies, I'm not looking for subluxations in their spine. I'm letting them show me what tension patterns they have in their body, which different ways their body could use some support so that they could open up and be more expressive. Baby adjustments are 100% completely baby-led if you let them. They will lead a prenatal chiropractor every which way that they need to be led in order to find the release that they need. So also, if you're a prenatal chiropractor listening to this, trust yourself, trust the baby. Don't overthink or overanalyze in the moment. Just let what happens, and that baby will guide you all the way through the adjustment. It's honestly usually one of the easiest adjustments of the days. I don't have to do too much work because I let baby tell me what they need. I'm not telling baby what they need. Sometimes I'm telling mom what she could do to help baby continue to stay in this state at home. But again, I'm not telling baby, like, put your leg over here. Your head should face this way. We're just gently finding tension patterns, releasing them, and then letting the baby tell us where we need to go next. If you take anything from this episode, it's having a recovery plan. Have a recovery plan before going into labor. I realize you do not know what's going to happen during labor and birth. Nobody does, except for maybe some people who have planned C-sections. But for the most part, a lot of people don't know what's going to happen during labor and birth. So it's hard to create a recovery plan. This is me telling you don't have to have a very specific recovery plan. Have a recovery team. Have your chiropractor in your corner. Have a lymphatic drainage massage waiting for you. Have a pelvic floor PT waiting for you, so that when you're ready to start these recovery processes, you already have a full team who knows who you are. They're ready to help you. You can explain to them what happened during your birth. They're going to know how to help you. Dads or birth partners, your wife, your laboring mom has been through a lot. Help her, give her the time, help her create a recovery plan, help her drive to said recovery plan, offer time to support baby while she needs to go do said recovery things, whatever it is. There are so many ways for birth partners and dads to help support in this recovery plan just by providing baby support, watching baby, driving mom so that she can get the care that she needs so she doesn't have to worry about driving or carrying baby, whatever it is. Help your mom. This is a really great invitation and space to create a plan for something you don't know what's going to happen, but you have everything out waiting for you as soon as that baby comes out. It's never too late to heal. Some mamas just cannot get to our office before 4 or 5 months postpartum. For whatever reason, they just can't make it happen, whether they don't have access to a car, whether they don't feel comfortable leaving their house, whether their body just isn't comfortable moving or being in a car or coming to get adjusted. It's okay. I tell those moms, it's not too late to heal. We still have time. There's always, always space to heal. There is never a time where I would ever say to a mom, oh, it's too late. We can't heal that. We're always going to try our best to help mom heal whatever she's experienced, whether it's been a year, 5 years. I have moms who come in 20, just like my mom. I'll have moms come in who are 28 years postpartum. And some of their symptoms that they describe to me, I will say, what kind of birth did you have? They'll explain their birth and I'll tell them. I think some of these symptoms started all the way back from that labor and birth experience. And they will just be like, oh my gosh, holy moly. And we help those women heal too. It is never too late to heal your body. Also, going back on that story, just because it's never too late doesn't mean you should wait. If you have the ability to go get care and go find recovery tools and really feel nourished and like you're on this healing pathway, the sooner you can do that, typically the better. Nonetheless, it's never too late. And trust your body. Trust your body that birthed your baby. C-section, forceps, vacuum, I don't care. Your body grew that baby and your body somehow figured out how to get that baby out. Even if it was a C-section and it feels like somebody took that baby out of your body, which realistically is what happened, you still can make that conscious decision of my baby is going to come out of my body. That is you delivering your baby. That will never get lost. I will never let moms lose that feeling, even if it feels like you did not get the opportunity to deliver your baby. You did. You absolutely did. You held for and cared for and nourished that baby all the way through pregnancy. This delivery is yours. It is yours to hold on to and to heal from. So if it was a traumatic birth, if it was a lot to hold on to, let other people hold you and help you feel supported throughout your recovery experience and beyond. You should never have to feel like you're alone or like nobody else went through this, or you shouldn't feel embarrassed. There's no need for any of those experiences or feelings to come into new experiences where you're trying to heal and recover from such an exciting, big, cool event that your body was able to do, which was create a baby and bring that baby into this world. If you're still here, thank you so much for listening. I am going to go through the quickest. If you had this intervention, here is your tangible recovery tool. I'm going to go through that quick list right now in case it felt a little aloof throughout the episode. I know I go off in rants. So let's just go down the list really clear. Intervention and recovery tool. If you had an epidural, focus on your pelvic floor reconnection, chiropractic care, alignment and nerve flow, and myofascial release or scar tissue massage if you had a tear or prolonged pushing. If you had Pitocin, support your hormonal system with rest and blood sugar stability. Focus on nervous system regulation, chiropractic, and magnesium and hydration to help ease cramping and recovery. Make sure you're getting the correct magnesium. Remember, magnesium sulfate for preeclampsia, magnesium citrate for stool softeners, magnesium glycinate for relaxed sleeping, calmness in the body. If you had a C-section, begin scar tissue work once you're cleared by your provider. Usually that's 6 weeks. Add gentle core reconnection, diaphragmatic breathing, or side-lying exercises, and support lymphatic drainage by dry brushing, walking, or body work. If you had antibiotics, rebuild the gut microbiome and the probiotic-rich foods or supplements. Support your immune system with whole foods and rest, and watch for signs of yeast overgrowth, which would be itchiness, diaper rash in baby, etc. If you were given magnesium sulfate, expect possible sluggishness and fogginess, which is so real. It's the slug and fog. That's what you're feeling. It's very sluggish, very foggy. Support detox pathways with hydration, leafy greens, and light sweating. Light sweating. You don't need to get in a sauna. You can, but light sweating. Rest often and reintroduce movement slowly. If you had forceps, vacuum, or manual placenta removal, watch for pelvic floor pain, asymmetry, or tension. Work with a pelvic floor therapist or a postpartum trained chiropractor. Me. Baby may benefit from craniosacral or pediatric chiropractic care for head and neck tension. If you had general anesthesia, expect a longer coming back online phase. Prioritize sleep, hydration, and gentle movement. Support the nervous system recovery with quiet environments and body work. So, hopefully this episode was helpful for you. I really, really enjoyed going through different recovery aspects. I talk a lot about this in the office, so I'm excited to have this episode available for all the mamas who come to me, and I can't explain for more than 15 or 20 minutes about what they should do or consider. Now we have this full episode. So thank you so much for listening. If you found this episode helpful or insightful in any way, please share with another mama to be, a doula, another prenatal chiropractor, whoever it is that's on your birth team that you think would really benefit from listening to this episode. I hope you have a fantastic week. I'm Dr. Emily, and you've been listening to the podcast.